continue the sternoclavicular joint in detail. So till now we have covered what is the structure of your sternoclavicular joint, what are the structures that provide the stability. So the structure, it is a synovial type of joint and it is made up of the notch of your mandible and your sternum. Okay, notch of your mandible and your clavicle. Okay, so what are the structure that is providing the stability? So basically you have the sternoclavicular disc, then you have the capsule, then you have the three major ligaments. Now we will move on to the kinematics of the joint. What are the movements that is present over your joint? See the movements that is happening across your joint. So basically the sternoclavicular joint, it has most important 3-degree rotatory freedom of movement and it also has slight 3 translatory degree of freedom. Okay. So the main movement present in the shoulder joint is the rotatory degree of freedom. So what are the movements present? You have your elevation, then you have the depression, then you have protraction, then you have protraction, then there is anterior rotation of clavicle as well as posterior rotation of clavicle. So what is elevation? While you are doing struggling, you can see the clavicle is moving up. And what is depression? The clavicle is coming down. So what is protraction? You can see while you are protracting, your scapula is moving away from your spine, and during retraction you can see the scapula is coming towards the spine. So these are the rotatory degree of freedom that is present in your sternoclavicular joint. Then there is slight translatory degree of freedom also, that is your anterior and posterior translation. Then you have medial and lateral translation. Then you have superior and posterior translation. So these translation occur when you do elevation, depression or protraction, retraction, or when you do anterior and posterior rotation of clavicle. Now we are going to see what is elevation, how elevation movement is performed. So while you are telling about the movement, you need to first see which plane it is acting and what axis it is passing through. So elevation, you can see elevation is happening in frontal plane and the axis that is passing is anterior posterior axis. So here you can see this is your sternoclavicular joint and you can see elevation is happening in frontal plane and the axis passing is anterior posterior axis. Okay. So here you can see during elevation what happens? The lateral end of clavicle is moving upward and during depression what happens? The lateral end is moving downward. So while you are elevating your hand, if you do, see here, you are doing abduction of your hand. While you are doing abduction of your hand, you can see the clavicle is also moving with you. Okay, so the lateral end of your clavicle is moving upward and the medial end, lateral end, while you are depressing your arm, the lateral end is coming downward. Okay, so this is how the elevation and depression happen. And also during struggling also you can see the lateral end is moving up and down, the lateral end is coming down. So you can see the movement that is occurring in frontal plane and that is anterior posterior axis, and during elevation the lateral end rotates up and during depression the lateral end comes down. Now we will need to see the orthokinematic movement that is happening inside the joint, that is the concave and convex rule. So what is concave and convex rule says? Concave and convex rule says when a convex surface is moving over a stable concave surface, the rolling and gliding will be in opposite direction. And what is happen when a concave surface is moving? When a concave surface is moving over a stable convex surface, the rolling and gliding will be in same direction. In elevation and depression, what happens? The medial end of the clavicle is convex and the stable part is your nanotube and that is concave. So the convex surface is moving. Okay. So what happens? The rolling and gliding will be in opposite direction. So you understand the class. Thank you for listening.